Welcome again to Mountain Health Today. I'm Ted Owens, your host. Program produced about healthcare by the Tahoe Forest Health System. We have guests with us today. We're going to talk about patient advisory councils. We'll be back in a moment. Welcome back to Mountain Health Today. I'm Ted Owens, your host, a program about healthcare produced by the Tahoe Forest Health System. Today we're going to be talking about Patient and Family Advisory Council. We have some folks with us that can help us explore that and help us understand exactly how it works. Why don't we start first with some introductions of our guests. Janet, why don't you start?
I'm Janet Van Gelder, the Director of Quality and Regulations at Tahoe Forest Health System.
And I'm Doug Wright with Mountain Hardware and Sports in Truckee, California.
Trish, Foley, Patient Advocate for Tahoe Forest Health System.
Welcome, everybody. Thank you for making the time to be with us. This is an interesting area of outreach and learning and understanding. Trish, since you have the microphone, I'll direct the first question to you. If you could give us a little bit of a background about the Patient and Family Advisory Council, when it was established, how you determined what that model should be.
Sure. We actually had a meeting with our Board Quality Committee back at the end of 2013 to determine how we might best incorporate patient and family perspectives into the quality of care we provide at Tahoe Forest Health System. And at that time, we were deciding if we should do focus groups or an advisory council. And we had a conversation and did some benchmarking and determined an advisory council would be the best opportunity.
So by benchmarking, you were looking at other organizations,
Correct.
entities, hospitals that had something similar?
Yes.
And thought that this might be the best model for the community
Correct.
which you serve? Tell me, what's the composition of the council itself?
So it is currently, we have an active council where we have 7 current members. We are actively recruiting, so we're always looking for new members. We meet the third Tuesday of almost every month, about 9 times annually.
Okay, and when you say recruiting, is it recruiting or drafting? I'm looking at Doug here, and I'm dying to ask him how he got involved with the council. Doug, why don't you take a shot at answering that for me?
You know, I got involved. I was asked to participate by one of the doctors who's a friend of mine, and I had used the hospital for some health services, and so you have firsthand experience, which is really part of what we want on the council, is to be able to talk about what we experienced and then our thoughts of what could change to make it a little smoother, a little easier, a little more patient-friendly.
Have you been with the council since the very first day? Are you one of the original?
I think I am one of the original members, yeah.
If not the?
I could be the original member, actually.
Okay, and,
Yeah.
and, you know, I'm going to ask that you pass the mic over to Janet, because tell me, Janet, how does the hospital system or the health system benefit from the input that you receive?
Well, the council has been meeting now for almost 2 years, and what our operational directors and managers, they come to the meetings and they share processes or programs or services that we offer within the health system with the council members and ask for their input on how we could do things differently or better and really meet the needs of our patients and families. So for instance, signage seems simple. However, you know, we have many regulatory signs we have to have posted, but it's really nice to have the insight and input from our customers, our patients, and our families on how we could present our signs better so it meets the regulatory requirement, but it is more patient-centered, family-friendly to our customers, our community members.
So just to be clear for the folks at home, this has nothing to do with specific care and how it's delivered. It's from the patient's perspective on what it is to move through the process and that type of input?
Correct. Another example is discharge planning. So as a patient or a family member, they're a patient in the hospital, whether it's an inpatient or an outpatient, we've had our advisory council look at the process that we go through with them to identify areas for improvement on how we could better shall we say, go through the discharge process, whether it's discharge medications, the paperwork that we have to complete, the follow-up appointment with our physicians. So we've asked the advisory council members how we could make that, again, more user-friendly for them, so when they go home and they read their discharge instructions, it makes more sense and it's more meaningful to them than just a stack of papers. So that's another example. The Patient Family Advisory Council falls under our patient and family centered care concept philosophy. It's part of our quality plan and part of our strategic plan as a health system and organization. We find it so important and so valuable that our patients and families really provide the input to us on how we can improve our processes and our operations. And
Okay.
I think Doug can attest to the value of that group
Well,
to us.
that's actually where I was going to go next. Doug, you've been with the group now for a couple of years. From your perspective, first off, have you seen value in some of the things that the committee has come up with? Have you seen implementation of recommendations, that the council has made to staff? Let's start with that.
Yeah, that's one of the things that, obviously, medicine is highly regulated, and so you get on a council like this and you wonder, is it just for show? But it's absolutely not. As we've made recommendations as a council, implementation has happened on almost all of them. If it's possible to do it, they'll do it. And I think that's really refreshing, but it really speaks to the hospital too, and their desire to create a patient and family experience that is easier. It's hard enough to be sick, and so to have to navigate, this is huge. It's made a huge difference.
So I have to ask this question. Have you made recommendations that maybe as a layman you thought were a good idea that were shot out of the sky for one reason or another?
Absolutely. There's things there's a lot of regulations in the medical field, and so common sense, as we see it, doesn't necessarily always get to apply, but it's not because of the hospital's unwillingness to change. It's really just regulation that gets in the way.
And in addition to that, I would imagine you've learned a lot
A ton, yeah.
about how
Absolutely.
hospitals function, and you mentioned regulations. We're going to take a break, and we're going to come back and continue our talk. I want to understand a little bit about patient advocacy and whether you're seeing trends that are beneficial from the council's existence. You've been watching Mountain Health Today. I'm Ted Owens, and we'll be back in just a moment. Welcome back to Mountain Health Today. I'm Ted Owens, your host. Today we have some guests. We're discussing Patient and Family Advisory Council as it exists within the Tahoe Forest Health System. My next question is for you, Trish. If you would, please describe for the folks at home what your role is within the health system.
Sure. My role is patient advocate for the health system, and that basically consists of addressing patient complaints and concerns. We have a process for that, and my role is to be an advocate for patients in that process.
So if we look at the composition of the council, you described it for me, about 7 or 8 members, I believe. 2 are staff, is that correct?
Yes, we have 2 members that actually, because of their own personal experiences within the health system, they were asked to be a part of the committee or council, although we typically want to have community members and not just employees.
Understood. In your role, though, you're able to bring some real time, real life, perhaps stories for them to wrestle with without disclosing who might be calling, but that's a value, right?
Sure.
Okay. Doug, let me ask you a question. So oftentimes, I think in the healthcare industry, people are thinking clinically, but you have had a couple of successes as a council. Describe for me the whiteboards story.
The whiteboards were really just information for the patient and the family that's provided by the hospital. But there's so many times when you're in the hospital or you have a family member in the hospital that wants to know information. Maybe they missed the doctor's appointment. Maybe they want to know who the nurse is. All those kind of things, as well as the patient needs to know that. And so our suggestions were really just making that information available, even down to asking the doctor, give us a time range that you'll be there so the family can be there in case the patient isn't well enough to be able to relay the information to their family. And man, it happened fast. It was surprising. I think by the next meeting, the prototype was out, and those are the kind of things that, like I say, for us are just common sense things that we feel, but it requires some accountability from the doctors and from the hospital and even from the patient to make sure they're asking the right questions.
You'd indicated that it happened very quickly. Maybe this is a question for you, Janet, on the implementation side. Because you have to get everybody on board with using the whiteboards so they're effective, otherwise it falls flat. Was that a challenge to do, or did everybody jump on board?
Well, just to clarify, the whiteboards are in each patient room, and we're actually expanding that to other areas of the hospital because it is so effective, as Doug said, as far as sharing information between the clinicians and the patients and the families. The nurses that work in those departments and the staff need to be oriented to each section of the board so that they understand their part. And as Doug said, the nurses also have to educate the patient and family about, please note your questions, this is your section to ask any questions, this is where the time is when the doctor generally will round so that you make sure your loved one is there so they can facilitate or participate in the physician's assessment and their plan of care. So the staff was on board because they recognize the importance of communicating between shifts and with the patient and family. So once the training was completed, we noted over time there was improved compliance with the whiteboards, just so that once people understood exactly what information was vital and important to document on those boards.
Janet, in addition to the whiteboards, can you give me some other examples of successes that have come out of the council?
Absolutely. There's been many, since every month we share different operational processes and obtain input from our wonderful council members. Another one I'd share is our website, the tfhd.com website. The marketing community relations department was updating that, revising it, and we brought that to the council, and they provided wonderful input on how to make it look, again, user-friendly, easier to read, and that is up and running for people to view.
Wonderful, thank you. Doug, I have a question for you. Do you feel, or do your colleagues feel, members of the public that are on the council, that there's great value, that you're listened to? Is there good interaction between the council and staff? Do you ever feel like your conversation might be muted in some ways because of the staff? Tell me, what's the experience like?
I've not felt that at all. It's actually been unbelievably open. The communication goes both ways. When we have a suggestion that isn't possible or as it's suggested as possible, there's thought to go around to see is there some way we can implement part of it, or it's been very, very gracious. Everybody from the CEO to these ladies to the departments that present have all just been unbelievably open and are more than willing to hear what we have to say. So
Reasonable. And tell me, how is attendance? How long do your meetings last?
The meetings,
because you're volunteering. And
we are volunteering, and the meetings last about an hour and a half usually, and they're actually really, the time goes by fast. It's so educational from the outside perspective. It's really educational.
Has your perspective on healthcare changed?
Oh, absolutely, absolutely.
It's simple, isn't it?
It's easy.
Yeah.
It's easy.
Well, thank you. We're going to take a break. I'm Ted Owens, your host. This is Mountain Health Today. We'll be back in just a moment. You're watching Mountain Health Today. I'm Ted Owens, your host, and we are talking with our guests about Patient and Family Advisory Council that exists with the Tahoe Forest Health System. Trish, I have a question for you. Let's talk a little bit about the council itself. Mm-hmm. Tell me, how do you recruit members of the public to serve?
We have a couple different ways that we recruit. We do internally at the hospital have flyers posted for people to take one, to contact myself about the council. We also are now putting information into the discharge packets, so it's actually reaching a lot of our patients. We have had information. Marketing has very much assisted us with also recruitment, and we get a lot of recruitment from, or we recruit from department staff, people who think there might be someone that would be a good candidate.
And what's the process of vetting? Let's say you're limited to a size and you've got candidates that you're going to look at. Does the council itself vet the candidates, or does staff?
Yes, both actually. We have a patient family-centered care team, and we also invite the members of the council to be a part of any interviews we're doing to recruit new members.
And this is kind of a question that's unique to our region. We are a large destination for tourism. We have a large second home ownership population when they're here. Have you had any of the second homeowners, for example, wish to serve on this council, and is that a perspective that's missing, or you might add?
We currently don't have, to my knowledge, someone that's in that process. However, we would welcome that because, of course, they are a part of the population and we would want their perspective as well. And to me, it seems like that would be something that we would welcome, even if they couldn't be a part of the council every month or the times that we're meeting.
And since we're here, if someone who's watching at home wishes to maybe apply, how can they do that?
They can do that by contacting me, and that would be at just my office number, 530-582-6567. They could also contact just our 530-587-6011 and ask to speak with a patient advocate.
Trish Foley.
Yes.
Okay. Doug, I have a question for you. Tell me about the cultural diversity or backgrounds or experiences that the public members of the council have. You don't have to mention names, but is it a diverse group?
It is diverse, and I think we'd like to make it more diverse, but we have people that have had cancer, we've had people that have had family members in the hospital, we've had people that have had other serious health problems that showed up, and really, you know, it's all kind of ages and occupations, and it's just people that care about their community and recognize the importance of having a really sound, functional hospital, and so I think we all have to give back if we can, and so that's what we do.
How long is your term? Is it specified? Do you agree to something like a 5 or 10-year term?
The terms are 1 year renewable, Ted, and so I've renewed once.
Okay, good.
And we'll probably do it again.
Do you think that the work that you're doing is regionally centric to the Truckee Tahoe area, or is it much more broad than that? You're really looking at things through the eyes of a patient, regardless of who or where they come from.
I think that we're looking at it in the eyes of a patient, regardless of where they come from. Obviously, it's specific to our hospital and our community, but there's been a ton of examples over the 2 years that we've been meeting of people that have had experiences at other hospitals and have prompted questions and discussion about what we can do in our hospital to make sure that those same experiences don't occur.
That's good to hear. And Trish, in your world, you don't always, as a patient advocate, don't you hear about problems? Do you ever get positive feedback in your role?
Most definitely. We receive emails. People, I think, post things on the Facebook. I know that our CEO has received letters thanking us. So typically when that happens, we definitely share that information.
Share that with the council, and so it's not always about fixing something. Sometimes I would imagine it's about refining something.
Correct.
And trying to fine tune something and improve it. So what's the next step? You're recruiting right now? You're down one member, I believe, and you're hoping to grow it?
Yes, exactly. One member who was with us from when we originally started moved out of the area, so we dropped down to 7, but we also have someone else in the volunteer process right now,
Right
so
now
that
in the
will
works.
push us back up to 8.
Trish, so you're actively engaging or looking for recruiting new members. You want to grow the council?
Yes, definitely. Again, the purpose of the council is to hear the perspective of the patients and the family members, so we encourage people to be a part of that if they're interested.
Well, thank you. Thank you, Trish. Thank you, Doug. Thank you, Janet, for spending some time with us today. You've been watching Mountain Health Today. I'm Ted Owens, and we'll be back in just a moment. And thank you for joining us for Mountain Health Today, a program about healthcare in the broader region, designed to cover topics and issues that are of interest to the various communities with which we serve. I'm Ted Owens, your host, and we'll see you next time.